What is pancreatic cancer, its warning signs, and treatment? Pancreatic cancer is a type of cancer that grows in the pancreas. It is most often found in the pancreatic ducts and the tissue surrounding these ducts. It's important to know that there are many warning signs of pancreatic cancer, and not all of them are the same for every person. The most common ones include weight loss, pain or fullness in your abdomen, jaundice, sudden weight gain, vomiting blood or coffee grounds, and feeling full after eating only a small amount of food. Keep an eye out for these warning signs if you are concerned about developing pancreatic cancer. The warning signs for pancreatic cancer are typically vague or nonspecific and include changes in bowel habits, constipation, diarrhea, appetite loss, weight loss, fatigue, abdominal pain, nausea or vomiting. Pancreatic cancer is one of the most deadly forms of cancer. It is among the top 10 most common types of diagnoses in the United States, with its incidence rate steadily increasing over the years. Pancreatic cancer begins when precancerous cells grow in the tissue of your pancreas. These cells can spread to other parts of your body through your blood, lymphatic system, or airways. It can also begin when precancerous cells are created at a different site in your body and travel to your pancreas. The most common symptom for pancreatic cancer is abdominal pain that gets worse after eating. Other symptoms include diabetes, weight loss, jaundice, and indigestion. Pancreatic cancer is different from other cancers in that it usually does not cause any symptoms until it has severely progressed. Pancreatic cancer, an aggressive type of cancer, can be difficult to diagnose because there are no specific symptoms for the early stages of the disease. It is usually found after a doctor has detected signs of pancreatitis, acute or chronic inflammation of the pancreas, and ordered tests to rule out other conditions like gallstones, an ulcer, or pancreatic cysts. Early diagnosis is crucial for successful treatment. Pancreatic cancer begins with growths on the outer layer, surface, of the pancreas called pancreatic adenocarcinoma, also called exocrine pancreatic cancer. Pancreatic cancer is a malignant tumor arising from the exocrine part of the pancreas. Worldwide, pancreatic cancer is the third leading cause of death from cancer and has a poor prognosis because it spreads easily and often goes undetected until it has metastasized to distant organs. Pancreatic cancer typically presents with painless jaundice, weight loss, and indigestion. Some patients will also experience constipation or diarrhea, back pain, and abdominal swelling. Diagnosis can often be difficult because early detection relies on screening for pancreatic cancer by fecal occult blood test, FOBT, endoscopic retrograde cholangiopancreatography, ERCP, or other imaging modalities such as an ultrasound or CT scan. Pancreatic cancer is the fifth leading cause of death among cancers in the United States, according to the National Cancer Institute. A sign or symptom of pancreatic cancer may be weight loss or decreased appetite, which could be caused by an inability to digest foods due to liver damage. Other symptoms could include enlargement of the abdomen, pain in the upper abdomen, vomiting blood, jaundice, yellowing of skin, and darkening urine. There are several treatment options for pancreatic cancer. These include surgery, chemotherapy, radiation therapy, hormone therapy, and immunotherapy. Pancreatic cancer is a type of cancer that starts in the cells that make up the pancreas. It can be difficult to diagnose accurately because the symptoms are similar to other health conditions. The pancreas is a very important organ that helps break down food, produce hormones, and stores insulin. Pancreatic cancer is the fifth leading cause of death from cancers in both men and women in Europe. Pancreatic cancer is a type of cancer that starts in the pancreas, a glandular organ located behind the stomach. It is one of the deadliest types of cancers and has a low survival rate. It can be difficult to diagnose and treat, so it's important to know what its warning signs are and how it's treated. Pancreatic cancer can develop in different parts of the pancreas, but most often, it begins as an adenocarcinoma, a tumor that develops from glandular cells. The tumor may grow into nearby areas or spread throughout other organs, such as the lungs or liver. Treatment for pancreatic cancer varies depending on its stage. Pancreatic cancer is a serious cancer with no identifiable cause. Pancreatic cancers are hard to detect because they often do not produce any symptoms until they are at an advanced stage. The most important warning sign for pancreatic cancer is unexplained weight loss, usually greater than 10% of your total weight in 6 months or 2 pounds per week for 3 months in a row, though it is possible for some people to accomplish. Pancreatic cancer is an aggressive form of cancer that is difficult to detect early on. Once it has metastasized, it can be nearly impossible to treat. The National Cancer Institute estimates that about 25% of people who are diagnosed with pancreatic cancer will die within 5 years. To understand the warning signs, treatment options, and prognosis for this type of cancer, it's important to know what pancreatic cancer does to the body and how its progression typically unfolds. Warning signs. The Pancreatic Cancer Foundation says there are no warning signs specifically associated with pancreatic cancer because it rarely causes any symptoms before it has reached an advanced stage. However, if you experience any of the following symptoms for more than 2 weeks at a time without relief, please consult your doctor. Pancreatic cancer is the fourth most common cancer in the U.S. The pancreas is a large organ located behind the stomach. The pancreas has two parts, one that makes hormones and another that produces digestive juices. The endocrine part includes the alpha cells that produce insulin, which lowers blood sugar levels after eating, and glucagon, which raises blood sugar levels if low. The endocrine part also includes pancreatic polypeptide, PP. PP stimulates appetite and slows down food passage through the stomach so nutrients are absorbed more slowly from food in the intestine. PP also regulates growth hormone release from the pituitary gland cells in response to brain signals or growth hormone releasing hormone from the hypothalamus. Pancreatic cancers are often diagnosed at a late stage because they do not produce obvious symptoms until they have grown large enough to block bile production or cause bleeding from the pancreas into the abdomen. Pancreatic cancers are usually not felt during a physical exam and may not be detectable until they have spread to other organs such as liver or lung. Pancreatic cancer is a type of cancer that starts in the pancreas. It is known as a pancreatic neoplasm or a pancreatic tumor. Pancreatic cancer is one of the most difficult to treat cancers with an average survival rate of 6 months from diagnosis. In about 95% of cases, the cause of pancreatic cancer cannot be identified. In most cases, it develops from pre-existing benign tumors called adenomas that have turned malignant and multiplied at an abnormally high rate. Pancreatic cancer is one of the most aggressive types of cancer. It is difficult to treat, and it rarely responds to treatment. The cancer can cause abdominal pain, jaundice, nausea and vomiting, weight loss, and other symptoms. The pancreas produces insulin to help control blood sugar levels after eating. Pancreatic cells produce enzymes that aid digestion by helping break down food in the digestive system. Pancreatic cancer usually develops slowly over time. It is diagnosed when abnormal cells are found in the tissue of the pancreas during a biopsy or during surgery to remove the gland, pancreases. Treatment for pancreatic cancer may include surgery to remove part or all of the pancreas followed by chemotherapy or radiation therapy. Pancreatic cancer is a malignant tumor that starts in the pancreas. It is a deadly form of cancer and the fifth leading cause of cancer-related death in the United States. This type of cancer is rarer than other types of cancers, but it is often hard to detect early, making it difficult to treat. Pancreatic cancer is caused by a buildup of genetic mutations in the body. These mutations cause cells to grow uncontrollably and form a tumor. This usually happens as a result of smoking cigarettes or being overweight or obese. The pancreas produces enzymes that help break down food into nutrients during digestion and hormones to help regulate blood sugar levels. The pancreas also produces insulin, which tells the cells in the body how much sugar they need to produce energy. Pancreatic cancer is a life-threatening disease that generally affects people over 50 years of age. This type of cancer mainly starts in the pancreas and has the capacity to spread to nearby organs, such as the stomach, liver, and intestines. This video is only for educational use. Please consult your doctor for any medical and professional advice. Feel free to let us know in the comments. Before you go, be sure to like, share, subscribe, and don't forget to hit the notification bell to inform you when we produce other similar videos. Thank you for watching Better Body Tips and for your continued support.